accidental qualifications. And as Dr. Mark Jeffrey said, it's addictive. It's really addictive. Cosmetics is really addictive for everybody. What I need to introduce, liposuction in brief. As you're quite aware, liposuction is removal of fat. Break it, remove it, and then shape the body. Which parts of the body that you can remove the fat from? You can say almost everywhere, including the chin, neck, and of course mainly the abdomen, the back, the thighs, buttocks, and so on. What I use in my clinic, a machine called Vaser, and Vaser uses ultrasound-assisted liposuction. And my machine there is Vaser 2, which is state-of-the-art. There is Vaser 1, which is the original one, and this is Vaser 2. What we do with Vasering, we infuse with the tumescent solution, which has local anesthesia inside with different other chemicals. Then we use the probe of Vaser. Each part of the body has its own different probe to be used in that area. Then we do the suction and the fat before and fat after. I was trained with the American Academy with the godfather of also the Vaser, Dr. Hoyes from Colombia. And of course also with the European College of Aesthetic Medicine, with Professor Di Giuseppe. All of them uses Vaser at that time. And with Vaser, not only liposuction, you do also liposelection, which means that you select only the fatty tissue to be removed, and then you shape the body when you remove the fat. Challenges may occur after liposuction and liposelection. Skin laxity, very important. One thing we have to understand, liposuction is not a way of weight loss. It's for shaping the body. You remove the fat and shape the body. For weight loss, you have to have different kind of protocols, including diet and exercise. So skin laxity is one of the important things that you have to think what to do after you do liposuction. Retain emulsified fat. Of course, we are not magicians, we are doctors. And you cannot whatsoever remove every particle of fat which has been emulsified after liposelection. Retain tumescent fluid and evenness of the tissue and lumpiness, this is very important, and post-op pain. And of course, as you're quite aware, every patient wants to see a quicker result and recovery. Initially, as Jim said, I tried Icoone, and Icoone is a wonderful machine. It's a very simple. I am zero knowledge of Icoone. My dermatherapist, my wife Masuma, she is a wonderful technician on Icoone. The Icoone treatment are for everybody. It's very simple to use, and it gives the skin and the dermis a genuine workout and can be used to treat the whole body. We use it on face, we use it on the abdomen, we use it on the male breast tissue, we use it on the buttocks, we use it on thigh, on everywhere when we suck the fat and then tighten up the skin after that. And the good thing about it is totally customizable. Each patient, with gender, with age, we customize the treatment for that particular patient. And why Icoone? It has continuous microstimulation. You can see it has two rollers, the suction in there, and with the third kind of stimulation from the middle. So the tissue gets stimulated, the collagen tissue gets stimulated, and of course, it stimulates the lymphatic tissue. And it does remove the fat through stimulation, and of course, lymphatic drainage. As you quite aware, this is the lymphatic drainage map before or at the beginning of the treatment. We do lymphatic waking, I call it. So we stimulate the lymph glands everywhere, where there are main lymph glands, and then we start the what we call 3 different vacuum stimulation on the tissue and it has also biomechanical stimulation. Now, radio frequency, again, I did not have any knowledge about it, but radio frequency, that's called Radio 4, and I think there is a machine in the back of the room. It is quite interesting and quite promising. It does convert the energy of an electromagnetic wave into heat. And Radio 4 is a non-ablative radio frequency. It has three main characteristics. Number one, it uses radio frequency safety or safety system. Very important with radio frequency. If you do not know what you're doing, you may burn the patient, you have scalding, and of course the patient will reject your treatment in the future. This one, with this system, it's quite good, and at the same time safe not to burn the patient. Number two, it has 4 electrodes, and the main handset, if you see after we finish, it's not only quadripolar, it's almost 8 heads, the main handpiece, to treat the larger area, specifically at the abdomen and the back. And it uses much significantly reduced amounts of energy with respect to monopolar and bipolar systems. And one of the good things here, you have this head for the face rejuvenation, and it's called quadripolar radio frequency handle handpiece. And the last thing here, which is called variable radio frequency, there are a couple of other heads in there that you may use for smaller areas and for definition. I just want to remind you, when we do liposelection with Vaser, usually what we do is a treatment called high definition initially, and then change to 4D, which is 4-dimensional. And after a few slides, you will see the radio frequency by itself. That's why I said it's promising. It may show a very good result even without Vaser for high definition and or 4-dimensional treatment. Why radio? As we said, 3 technologies for 3 depths, epidermis, dermis, and hypodermis. Fully configurable, yes, and has preset programs, and it does reactivation of peripheral microcirculation. These are some of the indications of the radio frequency, like for acne, wrinkles, scars, stretch marks, thickening tissues, and ear lifting, firming, cellulite, and localized fat. And cellulite, it is one of the major drama that we face, whether we are doctors, whether we are beauty therapists, whether we are dermotherapists. It's one of nuisance that we have to treat. So bear with me. Now I show you some cases, clinical. This is my job. This lady had, this lady, she had laser treatment overseas, and you can see here the burning and of course retraction of tissue, which is unevenness in the tissue here of the lower abdomen. Here, after 10 sessions of Icoone post liposection overseas, you can see beautiful shape of the body and almost disappearance of this unevenness in her lower abdomen. This is my patient that I did treat liposelection with Vaser 2, these almost 3.5 liters of fat. With this scenario, you can see, most likely you will say, look, she will have tummy tuck because this is a big abdomen and it will flop. And by flopping, that means the excess skin and lax skin. But after only 10 sessions with Icoone, we do not need to have the tummy tuck, which is costly to the patient, and of course we include the Icoone with the package, with the Vaser to treat the areas of interest. Another case, which is more interesting here, you can see very big, what you call pendulous abdomen here, and we removed 5 liters of pure fat, number 1, 2, 3, 4, emulsified and then become very thick here, and this is again after 10 treatments of Icoone therapy. Now, I said, let's try Icoone by itself without the Vaser. Here you can see the axillary fat pad, very obvious. Here, the axillary fat pads after only 5 sessions. The patient was amazed because she was told that if we remove the fat pad by surgery or by liposuction, not by me, of course, by different doctor, your breast may flop, and because of it giving support to the breast tissue. And she was worried that what we're gonna do after that? Do breast lift, and then a lot of thinking, and of course, patient always try to educate patient. And before that, you have to, like for myself, I have to educate myself to talk about what I think the right procedure to the patient. So basically, you can see the improvement in the infra-axillary fat pad after 5 sessions of Icoone. Here, infraorbital fat pad with a small piece of Icoone. This is 10 sessions. And now we're coming to the interesting things here. A patient came to me with pendulous abdomen, low back pain, very frustrated with his weight. He does a lot of gym. He cannot get rid of the fatty pendulous abdomen. We removed almost 3.5 liters of really thick fat, and as you quite aware, fat in a male person is much thicker than a female person. We did Icoone, then we got the radio frequency for the last 4 sessions, and you can see the results after that. And he was very amazed with the result. He was very worried about this beautiful stomach. Here, again, very interesting. This lady she didn't have that much fat at all. She wanted her stomach and she wanted the abs. And somebody told her don't do anything, but she insisted on doing the Vaser. So we Vasered her. This is the result after Vaser, 2 weeks after Vaser. And this is the result after Icoone, and you can see how beautiful started showing the lateral lines, the midline, and of course starting to showing the abs line. And when we did the radio frequency, now you can see beautiful shape, and she's quite amazed with this results and quite happy with what she got. Here, no vasering, only Icoone plus radio frequency. Icoone to move up the fat, to stimulate the lymphatic drainage, and after only 3 sessions, you can see improvement in the torso of the patient, bit of lines, lateral lines of the rectus abdominis muscles, and in the same time you can see the bulging of the stomach in the lower part here lifted up, and you can see this is the oblique shape of the same person after treatment. Even improvement in the back, but you ask me, what did you do to the back? I just did Icoone to the back, no radio frequency, but the patient, it's only 3 sessions of combined treatment in the same session of Icoone plus radio frequency. Here, another interesting case, Icoone plus radio frequency. Everybody aware, we are men and we have apple-shaped abdomen, and it is very classic of office kind of people. And you can see here 10 sessions of a combined treatment, Icoone, radio frequency, after only 10 sessions. This is the lateral projection of the same patient. The patient's abdominal circumference or waist circumference went from 112 to 98. But he did treatment is 10 sessions of Icoone plus radio frequency. This is the other side of the same patient, and this is the same patient when he was lying down. You can see here improvement in the flanks and improvement in the shape. And believe it or not, no change in diet, no change in exercise. The same office work, come to the office, do the treatment, and go home. The only thing we ask for patients after Icoone and after radio frequency and even after the Vaser is to drink plenty of water. And specifically when you have the fat emulsified, you have to stimulate the lymphatic drainage, and then when you drink water, you push it out with the bowel motion and of course the urine. This is the lying down lateral view, and you can see improvement here, the full of fatty tissue here, and of course here improved. Now, all of us have seen some patients with gynecomastia or male breast tissue, or in other slang is male boobs. This is the picture. You can see how thick the fat here, pendulous breast tissue, and a patient, if he's scared from doing surgery, from liposuction, what we do is radiofrequency, and we did 10 sessions, and that's his picture after 10 sessions of treatment, lifting of the breast tissue, removal, you can say, almost the same effect of Vaser, and of course tightening of the skin. And the patient after that was extremely happy. Now, reshaping the body is also very, very important. And we say, let's try on this patient. You can see here some mild scoliosis and some abnormality in the position of the person. And after only 3 sessions, you can see straightening of the back with nice, better curvature and better muscular appearance of the back. Whoever does liposuction and does 4D or high definition not only for the stomach, we do it for the deltoid, we do it for the neck, we do it for the back, we do it also for the thighs. Here you can see the line of the deltoid, and you can see it is not that clear. And believe it, here only we treated this patient with 1 session of radiofrequency, and you can see nicely demarcated line here, and it's different than the hazy line here. And here you have Gold Coast, you have plenty of beaches here, so basically it's a good kind of treatment you can offer your patients to do definition and high definition, and I'll be more than happy to talk to you over the phone how to do it, and it is quite interesting. In conclusion, Icoone may help skin tightening, homogeneous appearance post-liposuction, stimulation of lymphatic drainage. This is, the money is here, and evidence to be seen after the first treatment, and of course it stimulates collagen and has the ability to offer a non-invasive treatment for different cases, and of course growth of the business revenue. With radiofrequency, it does restore the derm tonification and elasticity. It reduces the thin wrinkles of the face. Unfortunately, I don't have a slide on that. And it redefines the facade and reshape the silhouette of the person, and also slows down the aging. In summary, beauty is not about appearance, it's about behavior and good manners. What Icoone does is a machine with good manners to improve the behavior of the tissue, which ultimately leads to better appearance, while radiofrequency is a machine with a good behavior to improve the manners of the tissue, which ultimately leads to best appearance. And thank you.
Any questions?